Hello, very nice to see you. Thank you very much, Bob, Mike, David. I'm honored to be here. A little intimidated. This is, after all, is Boston Red Sox, etc. But more importantly, the core and actually the fulcrum of all biotech in the world. And so for that, it's a delight. In the next half hour, I hope I'm going to at least stimulate some ideas in your mind, contextualize what's happened, and give you some ideas to think about. I may or may not have things that you agree with. And I certainly don't claim to look into a crystal ball and know what is going to happen in the future. I think anybody who tries to do that is completely insane or lying, one of the two. But I will give you a glimpse of what I think is right now on the cusp, and being able to do that might frame what you're thinking about. So let's go into this. I think it's really absolutely true to say that right now, it's very difficult for us to think anything other than this is a moment of time which is remarkable. In actual fact, there has never been more rich, more diverse types of things that are happening in our industry. And at the same time, I want you to know that we're actually at an existential moment, in my belief, in biotech. And when I say that, I say it with all sincerity. Look what we've done. Huge, huge benefits have accrued to people. It's not just a little bit, it's lots. And this data is already out of date. And economically, and life expectancy has just been gone wild. This we can argue about, but the facts are clear. These facts stand on their own as being a demonstration of what you and the industry have done for the nation. And I'm going to come back to the nation at the end. It really is the best of times. Scott Gottlieb, I'm sorry, has gone from the FDA, but he's left a legacy there. 2018 was a record year. There was a change in culture. The FDA is evolving. The FDA is a partner. The FDA is trying to do what it should be doing. And we can argue this, but if you look back to 2007, and yes, I'm old enough to remember that, it was really, really different. Very different. And we are seeing in front of us a sweep through that agency trying to help people evolve. And yes, guess what? Those VCs, how many VCs in the audience? Come on, own up, you're liked. Promise you. Not one, amazing. Okay. Okay, guys, they are pouring money in. They're pouring money in unprecedented amounts. And more than that, they're pouring money in large amounts. And when I say that, what does that tell you? It tells you that you're beginning to see confidence in capital allocation that will last beyond what the short-term market thinks about. When you put $300 million into a startup, you're saying, I have confidence, irrespective of what the market is saying, and I'll take time to get there. This is really an interesting change. Back in 2007, average raise, $10 million. Today, it's huge. And at the same time, the modalities have opened up. Isn't that wonderful? I mean, how many of you in 2007, 2009 were thinking about these as realistic modalities? I think that it's remarkable for us to contemplate that today it is reasonable to think about an ASO. It's reasonable for us to think about a gene therapy. It's reasonable for us to think about even CAR T. Okay, we'll get there in a minute. And we did cure Hep C. Everybody said nukes would not work, and then they did. And look what's happened. This is remarkable. And as you think about immuno-oncology, some of you may recall I had something to do with it round about here. 2009, nobody believed in immuno-oncology. Nobody. You need to read the analyst reports from 2009. What they say at that time is this is interesting but has failed. Pfizer unfortunately terminated their program. The only group that really believed in this, actually one person, Brian Daniels. Brian Daniels at Bristol Myers Squibb, who convinced me that this was going to be, let's go back, going to be something very special. We needed to take a risk. And by golly, the industry did take a risk. Look what's happened in that period of time. 2014, 50 trials. And today, over 2,500 trials. Now that brings its own particular questions, but these facts are completely real. You can go and see them on clin.gov. You can see how many trials are running today. The question is this science or is this shotgun? I would pose that question to every single scientist today in immuno-oncology. How can 50% of the capital going into the biotech industry be diverted into these trials in a rational fashion? But it also breeds something else. When products emerge from this, what will that mean for the biosimilars world of the future? Because each one of these is a biosimilar to come. So, lots of interesting questions from that. And we're not just thinking about those particular products. Behind this is coming the whole concept of cell and gene therapies. This is a wave, an enormous wave. I really love the fact that we're seeing new cell therapies being developed. The first RNAi approvals in 2018 and the first in vivo gene therapy. We should feel super proud on that. It's not that it happened alone. It happened in a community. You are part of that. You created the infrastructure to actually think about it and then stimulate it, get people to believe in it. But look at this. Reading from the preclinical side all the way through. This is preclinical. This slew of preclinical studies are happening. This is what you have in phase 1 and phase 2. That's an avalanche just waiting to happen. It's not just a technological avalanche. These are cell therapies. Now, what does that mean? A cell therapy doesn't happen, oh, I've got a cell therapy, now you take it. It means a change in medicine. Where will you provide these cell therapies? How will you manufacture these cell therapies? How will the FDA look at them? What is going to happen at the end of this? Remember small molecule generics fight? Wait till you see this one. Wait till you see this one. This is an entirely new world that we're entering into. So it's not change is coming in a way that is way beyond technological change. It is change that will infect and adjudicate across the entire industry and the medical practice, the insurance practice, everything. And that's what I'd like to talk about now. Because that wave is crashing on us, and we should take notice of it. We should take notice not just of these incredible technological changes. We need to understand what's happening, what is the context under which we are actually creating this innovation. You know, it's rather wonderful to know one of the great heroes of this industry is actually Roy Vagelos. Great hero. Beyond any that I think I can, if I want to put one finger on one person in the industry who knew what he was trying to accomplish, this is the person. Roy, however, in 2004, said something which we all didn't hear. It was at Wharton. Yeah, I know Wharton. Who went to Wharton here? Come on, own up. There, thank you. Great place, right? Exactly. This is what he said to the students. Roy had the belief that breakthroughs would stop the tremendous antagonism of the industry by simply showing how great it was. Not so. Despite this, today, every day, this morning, for example, Gilead being attacked over its work on HIV. Every newspaper goes after us. The public sentiment is completely anti-medicines. You have a body of work that's out there which is growing hour by hour, day by day, this a sentiment which is completely contrary to all those wonderful things I just shown you. All those wonderful things I showed you. Coupled with which, don't forget, right now, we had a settlement yesterday announced between Purdue and a company and in a lawsuit. You have 70,000 people a year dying in the opioid crisis. That sentiment is going to sweep this nation. It's going to be focused, whether we like it or not, on the pharmaceutical and biotech industry, whether we are guilty or not guilty. It doesn't matter. That's the context of these wonderful discoveries that we have right now. And aside from that, what you need to understand viscerally, and I do mean viscerally, is something else is happening. Vertical integration, consolidation of the hospital systems, and complex distribution and rebate systems. These look like they're vague and difficult, but they tell you exactly what's going on and what we have to live with. And you need, if you're in a lab, if you're in the clinical trials, if you're in the commercial team, you need to understand this. If you're on the boards of every company, you need to understand this. Look at this. The insurers are consolidating. This was just last year. Last year we saw what I'd call is a bit of a revolution. I'm going to show you why in a second. The consolidation of all of the major players. And they did vertical consolidation. Insurer, PBM, pharmacy, distributor. What does that create? Think monopoly. Think monopoly. Don't think otherwise. Think negotiating power. And then, even within the last few months, the shuffle continues. Anthem understands that PBMs can make the money. They form their own. Catamaran folds into Optum. Cigna now working with ExpressWith. This is pretty big stuff. You need to understand these are huge companies. They dwarf the pharmaceutical companies. Each one is larger by an order of magnitude than most of the companies in our industry. And yes, we talk about single-player systems. Come on, folks. Let's not kid ourselves. 44% of the US population today, let alone Medicaid, Medicare, 44% are already in the hands of 5 companies. So let's stop this. This debate about healthcare is central to how innovation goes, because these people control how you price. And what do I mean by that? Hospital consolidation is happening in front of your eyes. Remember what I said about biologics? Where do you give a biologic? It's an infusion. Where does that happen? In a small outside center. What are happening to the small outside centers? They're being consolidated into the hospitals. And the hospital systems increase prices dramatically. Today, the facts that you can see, a generic cancer drug are marked up 10 to 100 times in a hospital system. Please understand this. This is not trivial. This means it reflects on us. The branded drugs marked up tremendously. And when we have infusion centers being bought into the hospitals, what do you think is going to happen? What do you think is going to happen? And who's going to get the blame? And take a look at this little story. This, if you want one little example, how many people know what the average income in the United States is? $29,000. Okay? How can Scott take out of his pocket or her pocket $400 to pay for their drug every month in a system where the manufacturer purchase price is $400 and the manufacturer retains $88? This complexity is an absurdity. I have no other words for it. It is outrageous that an individual in a nation as rich as ours cannot afford to pay for insulin. It is not right. It is not democratic. It is not appropriate, and it's economically stupid because that individual can and should and would be working hard to create economic value in our society, let alone all the ethical issues. So you need to think about all these great discoveries that are coming in that context, because unless we understand this, unless we understand who's actually taking value out of the system, we will never be able to help everybody. And it's our covenant, at least it's mine, covenant with the patient that you give them the medicines they need. It's not about social medicine, not about socialism. It's about economic growth. Democracy and healthcare are intimately linked, intimately linked. And guess what? If you have a system like that, who starts to ask for more? Okay? It's not you. I don't hear John Maraganore saying, gee, let's immediately raise prices. I don't hear us saying, let's get the highest, let's squeeze the highest. I do hear the intermediaries saying, boy, we're suffering. You guys need to raise your prices. And that's factual. You just have to read the annual reports. Our products are suffering because the pharmaceutical company is not raising its prices. Our margins are decreasing. Well, tough. But nevertheless, who's actually benefiting economically from all of this? Well, a while back, it actually was, in 2013, a short 4 or 5 years ago, it actually was those who were making the drug. They were getting more, 40% versus 38%. That's crisscrossed. And unless we watch further on, unless we watch and pay attention to this, unless we watch and change the system, this is going to increase. It's a really important consideration. So it's also doing something else. It's shifting the political balance. I'm not going to try and read the slides. I got lots of wordy slides, so please read fast. And English is not my first language, so I try and put lots of words on, and that's my excuse. I can speak the language, but I can't read it that well. But you're having a political balance that's shifting in a way that has never shifted before, in a way which is radical, in a way which we've not seen. And it's not one side or the other. People can argue about that every which way from Sunday. There are incredibly important considerations going on the Hill, incredibly important considerations happening on the ground in every single state. And 2020 offers the opportunity for one of the greatest discussions around drug pricing that you've ever seen. And it will be used. It will be used by every single party, every single politician, and it will affect us. It will affect us in a way that, yes, we talk about the Affordable Care Act and the attempts to remove that. That too will affect everything that you see. The center of 2020 resides around healthcare, it resides around drug pricing. And if you think waking up in the morning and having your kid ask you, why are drug companies so bad, is a question that won't be asked in millions of households, you're wrong. That's going to happen. It's as if it's already part of our culture. The one place, I mean, just think about it. You save a life and you're a bad person. I have been shot at. I know what bad means. I know what bad means big time. That's not even remotely close to what you read about here. So what's coming? Okay, that's all the depressing stuff. What's coming? Lots of innovation, tons of it, just incredibly exciting. I'm a technology geek. I love watching that. More consolidation, increased pressure of pricing, massive public scrutiny, and short-term political gains and attempts which are going to have a long-term consequence. But, you know, I've always wondered if you sit in a storm and you're in your boat and it's rocking and it's miserable, and you're saying, oh my God, I'm going to sink. You're done. You're done. Do not do that, everybody. I'm asking you as the community that thrives, the community that actually generates this, not to do that. This is one of my heroes, Rudyard Kipling. Keep your head, because there's an absolute need. This need, whether short-term or long-term, is understood by everybody. You understand it. You know that Alzheimer's is a wave coming. How many of you has a family member with Alzheimer's? Look at that. I would guess 40% of this population here has somebody. We know what this means, so we're going to solve it. I have little doubt we'll solve this. And I asked a bunch of people, if you've really got good eyesight, you can see, because I don't normally trust everything I have to say. I do sometimes, but on this topic, I want to have better brains than me around the table. I asked Karen Bernstein, Ron Cohen, Jean-François Formella, Fred Frank, Jim Greenwood, Paul Hastings, Peter Kolchinsky, John Maraganori, Ken Mock, Andy Plum, and Stelios Papadopoulos, just to share with me their thoughts about what's going to happen. And I will confess a slight bias. I do believe we're going to have breakthroughs in Fragile X and Angelman, but that's a bias, let me just say. I also believe that despite failures, and every failure you learn from, every failure you understand, and if you do understand it, don't walk away from it. Investors might walk away from it, but you won't. You are the true lifeblood of what happens in biotech. You will understand, why is it that there was a failure? Does that lead you to a new kind of thought process in Alzheimer's? And okay, move on. You learn from failure. That's what you do. Every failure closes the door, but it opens others if you're smart about it. I do believe we'll see massive changes in cancer, genetic manipulation, but biosimilars. Please understand, if we do not solve biosimilars now, that crashing wave of the PD-1s, the cell therapies to come, will create monopolies of the kind that will lead to worse behavior of companies and worse behavior of the press towards us and worse perception by the world to us. We need to solve biosimilars now. You cannot have perpetual monopolies around old molecules. It's bad for innovation, it's bad for the industry, and it's bad for our future. In addition to which, a couple other things which are kind of interesting. I think you're going to see sweeping changes across payers and regulatory areas, organizational changes. I think that the patient finally will, because it's our ability to define the individual as being most important, the patient finally will come back into the company. We separated from them. They were to be dealt with by the marketing groups. That was always a very poor decision. But it was thinking about patients selling motor cars to patients, to individuals. We're giving drugs to individuals. Every drug that you give, the minute it crosses a lip, the minute it's taken into you, by vein, by orally, whatever, it changes your life. And as a company, that covenant that you hold must be integral to how the company is structured. The patient is at the center of everything you do, everything. So organizational change, I think we're going to swing back so that patient centricity becomes much, 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 much more embedded in the culture of everybody. One of the more exciting areas is I think we'll see complete revolution over the next 10 years in how we use AI and other tools to improve our digital interface. Don't want to spend, that's a whole subject in and of itself. And I think we will need to deal critically with some of the ethical concerns. We already see hints of this from China. The next 10 years holds just the beginning of what I think we will see. And finally, I mentioned to you before, I want to see lots more investor and biotech confidence. The ability to invest substantial amounts of capital, irrespective of what the outside world says. Remember what I said in 2007 about immuno-oncology, 2008? Nobody believed it. Nobody. Only Bristol had the courage to step forward and say, we're going to buy this out, we're going to invest in it. Had that not happened, had that investment not occurred, there would be no or very little immuno-oncology today. You have to take the contrarian view. And that's why I believe today neurology is on its cusp. The contrarian view always wins. Following what everybody else does is no recipe for the future. It's simply boring, and it's not constructive. So, what's going to stop all of this? Pricing. Pricing concern is at the heart of everything we do. You need to understand that, and you need to believe that, and you need to act on it. It will, across the board, all of the people that I've spoken to understand this. And for those who don't yet understand it, I would urge you, please, to make it part of your daily discourse. How are we going to work on this? And I'm going to offer you some tools in that. So I believe there's a strategy for dealing with this. Definitely. There is a strategy for dealing with pricing. It needs to rest on 4 pillars. We need to protect patients from out-of-pocket and unaffordable costs. We need to have access for them to all the medicines that they need. Now, this is policy stuff. You can do this. MassBio can put its shoulder behind this, that's for sure. We need to change and take our focus on the insurance systems so that they actually do forever take people who are ill. You can't just exclude people because they're sick. That's ridiculous and unethical and not democratic, period. And you need to believe that. It's not about buying something that's helpful and useful. It's about democracy. It's about taking your nation and making it healthy and making it productive and making it economically viable and making it the leader that it should be. We need to eliminate and reduce that incent higher prices. I personally think that every single CEO should change their compensation structure so that they never are awarded for price rises. For innovation, yes, not for price rises. And if you want to read about that, I'm on the public record for saying that. I don't believe price rises are a good thing. I think that they lead you to laziness. You need to be able to invest in your research and really get in there, put your money behind your new innovation, and believe that you can do a new launch, and a new launch, and a new launch. And oh, by the way, if you've got cash and you can't do the launch, then buy somebody who's earlier on and launch theirs. Cycle the money through the industry. But don't say, gee, I'm getting to the end of the third quarter, haven't quite made my top line, let me raise prices. That is not good news for us. We need to protect intellectual property in a way which is vigorous. And the way we're going to do this, some of us know, I know Bob, you know this, and I know that I'm going to be doing this. We're going to engage tactically with every policymaker, every provider, payers, and the patients and the public. So I'm near the end. So you guys are probably saying, what is this guy talking about? I'm talking about you. I'm talking about what I hoped at the beginning I could infuse into you. A framework for understanding what's important to us. A framework for at least thinking about what's going to come. And a framework for saying that in your hands lies the ability to change the perception if we all work together in a reasonably concerted way. Not everybody can do like think, but every single one of you needs to ask yourself, what can you do to make things better? And particularly, perhaps read what Collins and Porras said. They talk about sustainability, and they talk about it because of a purpose, a raison d'être to do what you're doing. Why should you be here? Why should your company exist? What is your purpose? And I would argue that the patient is that purpose, and your linkage to that patient is it. And I think you also need to do something which is sometimes perhaps difficult for you to understand or to feel comfortable doing. Speak out. Don't be hesitant. In silence, there's nothing. Nobody can hear your voice. Doesn't matter whether it be in the school, be it at at your, I don't know, at the church. Yes, I'm Jewish, and yes, I do go to a church because I happen to like a pastor a lot, and he talks really well. And yes, I do talk there, just so you understand. The guys at the synagogue, not so good. And also, they want me to speak in Hebrew, and I do, and I stumble in that. But I also think engage with the patient. The patient is critical because that's the community. That one group is our advocate. If the patient is us, the patient is the voter, the patient is the person who actually makes the difference to the policymakers. And I think because of that, I'm incredibly hopeful because I trust my colleagues in this room and all around the biotech industry. I'm very hopeful that we will galvanize, that we will drive innovation by doing this. And it's important to understand that Roy Vagelos, what he said was critical, but we need to translate that for everybody on the outside. And I think it matters for our industry. And I think it will drive immense returns if we do. But I go one step further. I think it's actually important for the United States. Because at its core, a nation that invests in innovation today is a nation that will triumph in the future. And by doing that, that nation will be an infinitely stronger democracy and one which continues to lead the world. Biotech in the United States has led the world to this time. My request to you, my challenge to you is, let's make jolly sure that it continues to do so. Thank you.